Have you ever looked down at your feet and noticed that bump near your big toe seems to be growing larger over time? Perhaps you've felt a dull ache when walking, or your shoes no longer fit the way they used to. Maybe you've told yourself, it's just a part of aging, or there's nothing I can do without surgery. But what if that wasn't true? What if there were proven, simple things you could start doing today, at home, that could ease your pain, slow the progression, and even shrink that painful bunion on your big toe? In this video, I'll take you step by step through what's really happening with your foot, why it's more common as we age, and most importantly, how to take back control naturally and gently. No expensive gadgets, no risky surgeries, just simple science-backed techniques you can do from the comfort of your own home. This information has helped thousands of people finally walk without pain again, and by the end of this video, it may help you too. So, please, don't click away. Your feet have carried you through life. Now it's time to return the favor and give them the care they deserve. Let's begin by understanding what this bump really is. Medically, it's called a bunion, or in more technical terms, hallux valgus. A bunion forms when the joint at the base of your big toe, called the metatarsophalangeal joint, begins to shift. The big toe starts angling inward toward the second toe, and the bone at the joint starts to jut outward. Over time, this misalignment becomes more pronounced, and the protruding joint can become swollen, inflamed, and extremely painful. But here's the part many people don't realize. Bunions don't appear overnight. They develop slowly, often over years or even decades, and usually stem from a combination of factors, some within your control and some not. One of the biggest contributors? Poor footwear. Tight shoes, especially those with narrow toe boxes or high heels, force your toes into unnatural positions. Over time, the pressure and friction cause the bones to shift. Women are particularly vulnerable because of shoe styles that prioritize fashion over foot health. But men aren't immune, especially if they've spent years on their feet in heavy, stiff shoes. Genetics also plays a role. If bunions run in your family, you may have inherited a certain foot shape or joint laxity that makes you more prone to developing them. Other contributing factors include flat feet, arthritis, and certain neuromuscular conditions. Even your posture and the way you walk can influence the development of bunions. But regardless of how it started, the question remains, what can you do about it now? The first thing you must do is switch to proper footwear. This is non-negotiable. Look for shoes with a wide toe box, meaning your toes can spread out naturally without being squished. Avoid heels higher than 1 inch. Go for soft, flexible materials that don't press on the bunion. Orthopedic brands often have good options, but even mainstream stores now carry comfort-focused shoes. Next, introduce toe spacers. These are small silicone devices that you place between your toes, usually the big toe and the second toe. They help realign the joint and reduce overlapping. You can wear them during the day or even while sleeping, depending on the design. Over time, they can gently nudge your toe back into a more natural position. Another excellent practice is bunion exercises. Yes, exercises for your toes. These are often overlooked but can be incredibly powerful in strengthening the muscles and ligaments around the joint. Try this simple one. While sitting, place your foot flat on the floor. Use your hand to gently pull your big toe into proper alignment and hold for 10 seconds. Repeat 10 times on each foot. Do this daily. Another exercise, toe curls. Lay a towel on the floor and use your toes to scrunch it toward you. This strengthens the intrinsic muscles of your foot and can help stabilize the joint. Aim for 2 sets of 10 reps. Now let's talk about ice. When the bunion is inflamed or painful, icing can bring quick relief. Wrap an ice pack or even a bag of frozen peas in a cloth and apply to the area for 10 to 15 minutes. Do this after walking or standing for long periods. And while surgery is sometimes necessary in advanced cases, it should always be the last resort. Recovery can be long, painful, and expensive. If your bunion is still flexible and the joint is not severely damaged, these home remedies can be incredibly effective over time. Now, you might be wondering, can a bunion really go away completely without surgery? The honest answer is, it depends. In the early stages, yes, bunions can shrink and become less painful with the right care. In more advanced stages, while the bone structure may not fully return to normal, you can absolutely stop the progression and significantly reduce pain, and that alone can be life-changing. Thank you for watching. If this video helped you, please share it with someone else who might be suffering in silence. The road to healing starts with knowledge, and you've already taken the first step.